children to be able to breathe through their nose using their diaphragm at a low volume that's sufficient for the body's needs.
During the light breathing activity, I will explain how to breathe through your nose using your tummy muscles while you are standing, sitting, or lying down.
And this is another
in some form or another. If you look on the back of the packets, you will find the hidden sugar content. Here are a few to look out for.
So they use this is pre the pandemic, but they are using the teledentistry right now to provide an online kind of teaching and education how they can develop good habits to help in their conditions. Okay. There is another kind of case now with the COVID, there is an increased implementation of teledentistry. This is one of the private clinic in the US. They are using teledentistry for limited evaluation and triage and hygiene assessment. So it's mostly because they have a few number of staff at the office. Imagine if the staff catch COVID, the dental office will be closed and shut down. So they did a very nice and smart idea by separating the staff. So the hygienists will have their own days to do the recording of all the patient data, the chart, the x-ray, the photos, all of that. And then they send it to the dentist who work remotely to give the treatment plan. So by doing this, they might minimize the exposure between the staff. Okay. And they started to use it as well for community outreach, this kind of minimal now with the nursing home and schools, and also for specialist consultations. So it will be if there's a need for an orthodontic consultations or prosthodontist, so they can refer the patients and have this remotely via teledentistry. I want to show you the schedule, how they separate the clinic schedules between the hygiene assessment team and treatment team. So each have their own days, and they do both. They do the synchronous and asynchronous teledentistry. So as you see here, and this is really helpful. It also eliminates the usage of PPE. As you know, with COVID, there is a shortage of the PPE, especially in 95 masks. So that was very helpful in reducing the expenses. It also reduces the number of employees in a facility, and it's very easy communication and patient convenience. Our patients are so convenient at their homes, receiving a comprehensive discussion around the treatment plan. Okay. So any questions so far from all of the attendees? So we almost reached the end. For any teledentistry program, there should be a considerations. Okay, let me see the chat. Okay, I've received most of the questions I received in direct messages, but feel free to send the questions to everyone. So I'm gonna say the question, what could be the limitation of teledentistry? Yes, there are limitations for any technology. There is limitations. So you use it only for the, you have to specify the use case. When you want to have a program, there should be a problem, a need in the community. I know like now everyone has implemented teledentistry, and sometimes they just like want to implement teledentistry to be with everyone and to catch this movement, but it's not working like this. If you just started implementing with any technology, it can fail. So you should define where's the needs, where's the problem in the community. Is it that the children can't see the dentist anymore? Is it because we have very busy parents that cannot take the children to the dental offices? Is it that patients are in homebound? They have many medical conditions, they cannot go to the dental office. So once you know the problem, once you know the needs, you can now assess. The second thing, this is the consideration I'm mentioning. You have to assess like the environment itself and the technology that you have. If, for example, you want to use a video conferencing, okay, secure platform, you should think of the security. Is it HIPAA compliant or not? If you are doing a video conferencing with the child, with the parents, do you want to store the data? Do you want to store there will be a problem of storage if you want to store the whole video. Some of the centers, they just do the video conferencing and they have the paper chart, the file, and they just record the chart of the patient. So they only use this communication, and by the end of the visit, nothing is stored. So there is no problem. But if you want to have the photos in the folder of the patient, in the file of the patients, then you should think about where you should store it. There should be a secure cloud. In Saudi, the legality here for telemedicine. So we follow telemedicine and the legality of teledentistry. For the photos and for the patient information, it should be stored in Saudi, in a cloud in Saudi. This is one of the very important conditions. Okay, let's see. And continuing on that answer, if you are doing if you only have a phone camera, a mobile phone, or a regular camera, you can only do screening. You can't do diagnostic procedure. And you also should consider the policies. Hopefully this is kind of comprehensive answer, but let me see the other question. Okay, does it have a trouble accepting it? I mean, some new technologies face a negative reaction because people don't like changes. Yes, correct. This maybe was in the past, but now I think each of us has a mobile phone. There is an increase kind of acceptance to the technology. And now like people are more open to that, and this is very convenient for them. You can do kind of assessment before and after. You can do assessment, and there's a specific assessment called the readiness, to see the readiness of your team to do teledentistry and the acceptance of the population. Now with the pandemic, everyone is using their mobile phone to do many, many other tasks, like shopping virtually and all of that. The next question is, how will be the treatment, I mean physically, in far areas? So one important thing is teledentistry is not replacing a dentist. Just keep this in your mind. It will just expand the services of dentists, expand the scope, so you are providing access to care. But it's been used as an adjunct tool, not a replacement of dentists. Still, with teledentistry, you have to see the dentist face-to-face, like to do the dental procedure. It's used mainly for follow-up, screening, so it's like before and after visits, to cut the number of visits and make it convenient for the patient. Another question, okay. Need for teledentistry could be underserved communities in rural areas or in big cities where people are very busy and seek to minimize trips to the dentist. Okay. Yes, actually, you can use teledentistry in both scenarios. There is actually need also, as there is need for underserved in rural areas, also in the big cities. Sometimes even employees, like in in their work, they don't have the time, like to go to the dentist, and they wish to see their dentist virtually, at least until they get the treatment. It's so nice if we have teledentistry along with mobile dentistry. So you get the first visit, the screening through virtual visit, and then the mobile clinic can go to the, and this is an existing model actually in the US. There's what they call it, VirtuDent, that goes to the workplaces and provide the services for employees at their workplaces. So it addresses also the needs of employees. COVID has accelerated public interest in teledentistry, and it can work very well. Yes, yes, I agree. Thank you so much. Thank you so much, Brad. And I'm glad you are joining us tonight. Duha is asking, will it be possible to diagnose a case only with technology? So you should have the expertise, you should have the right technology, You should have an evidence base that mentioning the effectiveness of this device. As I mentioned, we should refer to the research, to the best practices. So the program in France, in Europe, they are using the caries detection camera, and this can be diagnostic. Also, the smile room. Yes, my friend Tina's here. I'm glad that you are joining us. Thank you. Can you tell us, Tina, about the smile room? I'd like to hear about it with everyone. If you like to share, you can take the mic.
Hi, everyone.
Um,
So you can hear me?
People in the room, Tina is with me. She's the chair of the International Committee at the American Mobile and Teledentistry Alliance. We are honored to have her with us today.
Thank you. This has been great. It's so exciting to always hear about teledentistry. I can geek out about it all the time, so this is awesome. So the Smile Room, yeah, we do basically a similar thing that VirtueDent, as Dr. Alaa was just mentioning. So we go into workplaces and provide dental hygiene services. We've recently, since the pandemic, have had to switch our platform a little bit because people aren't really going to their workplaces yet. So we are providing the same service in residential buildings and soon into long-term care facilities for elder patients. And one of the biggest things that has come in importantly these days is the teledentistry aspect of it. So we are providing cameras to our dental hygienists who can then communicate with the dental offices where the dentists are at, as far as any concerns they see, or even just doing a well checkup. So they can do that remotely and look after that, not have to drag the people back into dental offices to do an examination. If there's something that needs to be done, then the dental office gets to really do proper diagnoses and treatment plan accordingly. And then when the patient shows up to the dental office, it's reduced the number of times they have to come in there, and they just get right to work and look after it.
Nice, nice. Thank you for sharing about that.
No problem. Thank you.
With the COVID, any challenges that was there, like with implementing teledentistry?
Not really. I think if anything, COVID has really helped the population at large learn more about telehealth, which then makes it easier to explain teledentistry to them. I mean, there's in Canada, which is where we're in, there's a lot of medical appointments being done through telehealth now. So people of all ages are exposed to it just because of the pandemic and the lockdowns and the restrictions in coming and going. So it's definitely helped people understand what it is that teledentistry does and what it can do. So, and they're much more readily accepting of it because it helps them not having to go into dental offices or as many times into dental offices and bringing the care to them. So I think the pandemic, if it helped one thing, it helped teledentistry and telehealth. So
I think it shows the significance of this technology.
Exactly.
Even like for years, it will become part of the practice for sure, like for
absolutely
a decade. Thank you so much, Tina.
No problem.
Thank you. So we have two questions, and then I will move on to the surprise of tonight. Thank you for holding all of that till the surprise. There's 2 points that I want to emphasize. When implementing teledentistry, there's a specific documentation. So this will be in other sessions that we can dig deeper and mention what kind of documentation that we have. There should be a consent. You should mention where's the site, originating site or the distant site. These are so important, and the follow-up care. So if you are implementing teledentistry in the place, you should indicate the resources for the patients, where you want to refer the patients to. Now I'm planning to do something for school-based children. I will update you maybe in the next session. How is the project going? Hopefully soon. So I will answer the next two questions, and then I will mention the surprise to everyone. So there is a doctor, is it working for oral cancer? Yes, it's so important in early detection of oral lesions. Like especially for the people and the older population and homebound patients, when they have their home care, nurses can use the camera. If they examine and do screening and there's something not going on, like right, there's a lesion in the mouth, they can take a photo. If there is a warning sign, maybe the dentist can instruct the nurse like to just have a swab or something and catch that at the early stage. And last question isn't going to be subjected to subjective evaluation. What about inter-examiner reliability? Yes, that's why there's like many research papers around that. It's so important, as I mentioned, the training component, the calibration, it's so important to minimize this kind of like differences between the examination between different examiners. So that's so important. When you have this standardization, you will get better results. And also the technology plays a very huge part in that, the right technology used in teledentistry. Okay, let's move on to the surprise. So as a surprise for tonight, thank you for all the students who joined us tonight. There's a surprise